Benghazi affair in the coming weeks. Cancer patients could see higher costs under Obamacare. Industry analysts warn of the thousands of dollars in new expenses for medications. The higher cost could hit those suffering with numerous chronic diseases, from cancer to rheumatoid arthritis. The cost could vary around the country by region. Some states are allowing insurance to charge patients larger drug copays in order to keep the premiums down. In California, for example, patients would pay up to 30% of the cost. Pat?
You know, Lee, we've been saying, people have been saying all during the debate on that ill-fated health care law that it was going to raise the cost. They couldn't help but raise the cost. But nobody knew it. It was so voluminous. And now there are thousands of pages of regulations. Nobody understands what it's all about. All it knows is that it's going to rip at the fabric of our healthcare system, which is without question the finest in the world. Now, there are problems with healthcare, to be sure. We have third-party payers, and so the person receiving the treatment is not billed for what he gets, and he is not aware of what's being charged. And hospitals are charging more than they should, and physicians are doing defensive medicine, and so the tort bar is licking its chops over big recoveries, and we do need tort reform. And there are a lot of things we need, but this monstrous bill was not what we needed. And we said it was going to hurt, and boy, it's going to hurt big time. The question is, will it hurt enough to change the complexion of the Congress in this next election? And it may be, we're not sure, but certainly the next presidential election. These things are like so-called chickens coming home to roost. They're coming in droves, flocks of them all over the place.